This is one of the most common issues that people come into the office hoping to treat, and those are frown lines and glabellar wrinkles, otherwise known as the dreaded 11 sign. You can see it on me right there. So this is something that's very commonly a concern as we get older. We kind of tend to make that frown. I think it's maybe starts after you have children because you start getting into scolding them. Other people say it starts right after you get married. But no matter what causes it, this is an issue that a lot of us have, and it is a very simple way. There is a very simple way to treat it very effectively. But let's start by talking about the cause of these wrinkles. And the cause of these wrinkles are overactive corrugator muscles. And these are muscles that are in this part of the upper face of the eyebrows. And when those muscles contract, you can create those kind of vertical wrinkles that we call the 11 sign. And so if this is the cause, the corrugator muscles are the cause of the wrinkles, it makes sense that the solution is to stop those muscles from contracting, right? That's the solution. And how best to do that? Well, you do it with Botox. Now, you can use Botox or another neurotoxin like Dysport, and these function by weakening the muscles that can create those wrinkles. So if the Botox is injected into your corrugator muscles, within about a week or so, those muscles will weaken and they won't create those wrinkles anymore. And it's kind of like it relaxes them to the point where if you lie on your back and you're completely relaxed, and if those wrinkles smooth out, that's the type of result you get. So the Botox or the other neurotoxin will weaken those muscles that create the wrinkles. We typically inject anywhere from about 10 to 20 units of Botox into that area for maximal effect. The results do last about 3 to 4 months, and it's typically very, very well tolerated. So how does the procedure work? Well, typically you come into YPS and see either myself or one of my injector specialists. They inject this 5 days a week. They probably do 10 times as much of these injections as I do because I'm in surgery several times a week. You come in, fill out obviously the paperwork and stuff, and then sometimes people use a little bit of ice to numb that area. Most people, the needle is so tiny, it creates so little discomfort that they don't need any type of anesthetic or anything like that. Then we take the tiniest needle and the smallest amount of Botox and just inject it into multiple little areas into that location. Okay, you inject it into there. It's tiniest amount of pain. It's easier than going to the dentist. And then afterwards, if you want to pull ice on it, you can. Most people don't really do anything, and that's it, and they're done. And we do recommend that you don't exercise that day, but otherwise most activities are fine. It does take up to a week for the Botox to really kick in, and then you should really start seeing things kind of smoothing themselves out. So what are some potential risks of it? The risks really are bruising. Bruising is definitely a possibility. You'll definitely have some swelling, although swelling usually is much better within a day or so. There is risks of the Botox migrating and going into the upper eyelid. Very, very uncommon because we're fairly far from the eyelid if you're in this area. But if it migrates and goes into the upper eyelid, it can cause the eyelid to droop a bit. That, once again, is temporary. If that happens to you, there are little drops that can be prescribed that can help with that. And those are the main risks that you see with Botox into the glabellar area. This is one of the most popular, probably is the most popular cosmetic treatment in my office for the last 10 years because it works so well. So let's take a look at a couple of examples of results. This was a patient I just showed you, her before picture on the left, her after on the right, and you can see how things are much smoother afterwards. Before on the left and after on the right, it really just kind of forces you to relax those areas. Like I said, as if you're lying flat on your back and really relaxed. This is in a male. We're doing a lot of Botox in men. This is an area that doesn't typically look done or plastic, and so a very, very popular area for men when they get these kind of furrows right here, those 11 signs, that it works really well. And another woman here, wrinkles on the left side, and you can see how things relax on the right. So this definitely works very, very well, whether it's Botox or another neurotoxin like Dysport. Another option that people have are injectable fillers into this area. And I have a lot of patients that ask me, can I inject a filler into my glabellar wrinkles here? That is an option that I use as a last ditch resort. Always you want to start with Botox. And one big reason why, well, number one is that the Botox affects the muscles, which are the cause of the wrinkles. Whereas if you inject a filler into those wrinkles, you are treating the symptom, okay? You're treating those lines that are left over from those muscles contracting, not the actual muscles themselves. But the bigger issue really with it is the risk of blindness. And there are blood vessels in this area that actually can go back to the brain and the eye and the actual eyeball to supply the eyeball. And people have actually gone blind from fillers in that area. So it's considered a danger zone. If you're thinking about fillers in the glabellar area, that area, you got to be really, really cautious. Final thing I want to let you know is there are some people where these wrinkles have been there for decades, for so long, and they're so deep that even when they lie back in bed and they relax, those wrinkles are still there. Okay, if you're the type of person that those wrinkles are so deep set, Botox won't completely get rid of them like you see in these before and after photos. It will still soften the wrinkles, but it can't make them completely go away. And the way I describe it to patients, it's like the wrinkles in my hand, okay? So I'm going to put this up in front of the camera. You can see the wrinkles in my hand. Doesn't matter how much Botox I inject into my hand, in my forearm, those wrinkles will always be there no matter how much Botox I inject. However, if I inject the muscles so that they don't move, I can't do this and make those wrinkles deeper. They just end up like that. But even if I stretch my hand out as much as possible, you can still see there are those wrinkles there. So if you're the type of person that you've got these deep furrows here, and even when you're completely relaxed, they're still there, once again, Botox can work for you, but it may not eradicate the wrinkles like you are seeing in these before and after photos. So Botox or other neurotoxins, by far, this is the best treatment if you've got frown lines or glabellar wrinkles, otherwise known as the 11 sign. A very simple procedure. Literally, the injection takes 5 or 10 minutes. It's the most popular procedure we have in my office. If you're interested in costs, we'll go over that at the end of the pre-consultation. I hope this is very helpful for you. We'll see you on the next segment.